Hi, I'm Mario Evon, and you're listening to Talk Truth, a weekly edutainment podcast discussing the things that most people are afraid to, but from a Jamaican perspective. From relationships, sex and sexuality, to the ins and outs of entrepreneurship, in this space we speak about almost anything with the intention to inspire, educate, entertain, and create a fair and balanced space where your truth shall become your power and set you free. Yo folks, it's episode number 5 and this is Mario Evon, none other, and you're listening to Talk Truth. And today's episode we're going to feature a medical doctor who goes by the name Dr. Yohann White, and he's going to be talking with me today about sexual health. And we're going to keep it broad, but we're going to touch on a lot of really cool things. Yohann, welcome to Talk Truth.
Great. Good to be here. Thanks for having me, Mario. Good to be here.
Tell me a little bit about your medical background. So you are a Jamaican. Where were you trained?
Right. Yes. I'm from Ocherius, the real Ocherius.
Not the other country?
Right. The third city.
The third city.
And I was trained at University of the West Indies, Mona campus. I left there in 2007 and I went on to do postgrad studies in disorders of the immune system overseas. And then I had the opportunity to come back here, taught at UA for a little bit, and then I went back overseas to do a postdoc. So yes, there's something after doing your PhD we call a postdoc.
How long was the PhD?
I did that for 5 years.
5, and where was that?
And that was in Japan.
Wow.
And I came back to Jamaica for a couple of years.
That's konnichiwa, right?
Yeah, konnichiwa. It's afternoon, yeah.
Yes,
like about now.
All right. That must have been an experience.
That was.
And then you came back and... and the postdoc was where?
That was in Maryland, in the U.S.,
right.
Silver Spring. So I was there for about 3 years. And I came back in 2017 to Jamaica, and I've been here since.
Okay, that's why I'd never seen you around, even though... Right. And... You've done a lot more though. So you've been back in Jamaica, but not just functioning as a general practitioner, but you have a company which goes by the name of...
It's Para Caribe Consulting. We're a health and wellness company that focuses on applied research. So we do that on behalf of government ministries, departments, and agencies, as well as non-governmental organizations, especially in the field of sexual and reproductive health.
Right.
So that includes surveys that inform programs, prevention programs, evaluating programs, updating guidelines, treatment guidelines, and
this
so
would be
on.
For the Ministry of Health, as you say, for the government,
right?
Mainly.
So not only the Ministry of Health, but other ministries are also interested in having applied research. So applied research doesn't have to always be health, and even though we're mostly physicians, some of these principles can be applied to other ministries. So we've had other ministries, we've worked with other ministries as well.
Right. All right. A little later we'll talk about how people can find you in that capacity. Well, today I wanted to talk with you about sexual health, and I guess in the world of immunology, a lot of the viruses, bacteria, and organisms that really cause hell in people's lives come across your path, right? And where would you say Jamaica is with regard to positive sexual health practices and in terms of testing and stuff like that?
You know, that's an interesting question, because we, as a culture that's very has a very bravado kind of a masculine feel to it, or belief, or surface, at least superficially.
Right.
We have certain things that we say that men shouldn't do and men do, and women shouldn't do and women do, etc. But the way I like to view sexual health anywhere is that everybody is doing everything with everybody.
Right. So
there's
it's an open playing field.
in a way, yes,
right?
It is. There's no specific box that anybody fits into perfectly. So everybody's really doing everything with everybody. That's my assumption all the time. And you can't, even if people tell you that
they're doing
they're only doing,
they might be doing things, Y and Z.
Right. They probably are exploring or have explored or maybe interested in exploring. So I usually approach it with a very open-minded kind of approach, and try to make people comfortable and feel okay in wanting to disclose various aspects of their lives and sexual behavior. So it's just assume that everybody's doing everything with everybody,
which I think is a great approach from being the physician. But with that said, there are at-risk groups though that are at greater risk of stuff. You would say that's fair?
Yes, from a public health perspective, but really one has to be careful because everybody's at risk, and if we assume that people are in these specific boxes, we can miss the opportunities to prevent ill health, right? So but yes, from the statistical point of view, there are some groups that may be at increased risk for poor health outcomes. And
is it based on their sexual practices and choices?
Usually not, because generally there's this approach we call minority health, where there may be some physical aspects that biologically make it easier for you to increases the opportunities or chances of you getting, let's say, a sexually transmitted infection or STI. But a lot of the pressure and risk comes from how your general society treats you.
Exactly.
So we call it marginalization. So those social aspects drive people away from information that could be useful to protect themselves, and also to access tools and measures and things that they could use to protect themselves, just because you're afraid that if you go to a health center, a doctor or a nurse or the security may look at you at a certain way, or run you out of the health center, which has happened, or you're going to feel ashamed to mention something to a doctor just because of how your society is, the things that you hear in the music around you, the things that they say in church or in school or your family is saying. So it makes you feel very cornered. And
I like how you're naturally segueing into where I want you to go. But it also makes me want to ask about, wow, I just blanked. All right, so keep on that track. Culture. So pretty much, I was going to say the size of the country, given that the population is very small too. How do you think that also affects the willingness of people to share?
Yes, for sure. We do have
the circles are small.
It is. We have a small island syndrome kind of a thing. And you see that exaggerated when you go to other Caribbean islands. So their islands actually smaller than Jamaica, right? But yes, everybody knows everybody here. And what you will find, some people adapt by trying to seek sexual health services by going somewhere else, far away from their community. So that is the primary way that people try to make themselves comfortable to get access to certain health services or information that they require. But it is a small country, and you have relatives everywhere. Somebody may be your cousin. No, I agree. I was going to say, it's funny that when I'm being tested for STIs, because I get tested because you should. Right.
I never thought about the people at the lab who are processing the results. That they're people who I know, who will see my name, recognize them, be like, yo, Mario may have some.
And you can imagine what patients go through. Because the people who, if you go to a health facility that's in your community, more than likely the staff are going to be from your community
or relatives or otherwise.
That's nerve-wracking for some people.
Right. All right. Interesting. You remember anything growing up as a child in terms of Jamaican sexual myths and that may affect healthy behavior? I mean, I know one about the virgins. Having sex with a virgin will cure you.
Interestingly, that one I learned as an adult, that people were actually subscribed to that kind of a belief in terms of grown adults, men especially, who may have an STI and they want to be cured naturally. There's absolute myth that if they have sex with a virgin, that it will cure it. And unfortunately, that has also now gone over into preteens and adults where there is abuse of our children because of that belief. Absolutely. And of course, there's no merit to it at all.
When I was in medical school, we did a community health project where we went to a few high schools to try and figure out the age of initiation of sexual intercourse. It was very revealing. I mean, we found that I think the boys were actually a little bit earlier than the girls, and we were functioning in like a 9 to 13 ballpark.
Yes.
And it was scary.
Yeah.
And this was across each school. And it was a small sample.
Mm-hmm.
But I'm like, wow.
Yes, it's not surprising at all.
Women were initiating young boys too.
That does happen. That does happen. In our culture, sexual initiation is viewed as a rite of passage into manhood for our boys, and it is reinforced in popular culture. So in the music that we hear, in how people talk around us, the bar talk, the way grown men talk, what is expected of you as a boy or as a man, and if you don't subscribe to those beliefs, then you are marginalized. You are viewed as less than a man, or not being a man, or your sexuality is called into question.
Exactly.
And so boys feel compelled, because you want to fit in.
Of course.
As an adolescent, your primary concern is to fit in with your peers.
Especially when you don't have anywhere to go.
Yes, it's more important than food and water to these
and
kids.
And then later on, if you don't have a youth, but that's a whole nother podcast, right?
Right. So they do and have to endure a lot of pressure from grown men, grown adults, from popular culture, from their peers to try to fit in. And this is what's driving that early sexual initiation. Women or girls are viewed a little bit differently,
right,
in that they are what they get hammered into their heads is that you need to preserve your virginity for as long as you can, because that is how you value yourself in this society.
Right.
And so you will find that their age of sexual initiation is usually a little bit older than the boys.
And then there may be some outliers who may be taught to use their sexuality to protect and guide them through life. Like this is your tool to get the things.
Yes, you put it very diplomatically.
You like outliers, I call them. But I'm sure they exist as well, right?
Yes, that is true.
All right, Yohann, let's talk a little bit about the medicine. And we doctors like to categorize things. So let's talk about some common STIs, but let's go curable and uncurable. This is my categorization, because I think that's probably where most people worry the most. Like, if I'm going to live with it forever, or I can get rid of it. And I know two common non-curable ones right now are HIV and herpes.
Right.
And you can add anything else that pops to mind, but those are two that stand out. In a way, I almost feel, you may agree or you may disagree, sometimes herpes is almost more annoying to people because they don't know when it's going to appear. They have to prepare for a flare by getting medication ready. They have to look out for the signs that it may come up.
Right.
And then when it's up, they can't do anything.
Right. And it's a good place to start, because herpes simplex virus, there's several types.
That's
one
right.
and two are the primary ones. It's very common.
And so one is normally night fever.
Yes, 1 in 4 persons has herpes.
In general?
Yes. So
every 1 or 2? Combined, all of them.
Yes, every 4 persons that you walk past has one of those herpes viruses.
They didn't know that until now. Some of them.
And commonly we see it on the lip, right? But it can be anywhere. And in general, we say that the one above the waist is herpes 1, and the one below the waist is herpes 2. But nowadays, people are turning in different positions, and it's very easy to have a 2 on the lips. And vice versa.
I'm glad that you said that. So all those people who thought your night fever has to be up at the top, you can get 2 up at the top and get 1 down at the bottom, right?
So, there's really, for practical purposes, there's no real distinction why it's 1 or 2. But it is a persistent viral infection, so there's no cure for herpes.
Right.
However, depending on your immune system or the condition of your immune system, you may be prone to having symptoms more than another individual, and there maybe majority of persons will have no symptoms at all, and to the extreme, some persons may have outbreaks frequently, like every month, etc. And it's driven by stress, whether physical stress or psychological stress, anything that can cause your immune system to function less than optimal. It gives an opportunity for that virus to re-emerge.
Because they call it dormant. It's in the nerve, in the ganglion, in the nerves.
Yes. Persistent viral infections. It is one of those. But there's treatment that is available. And what we advise patients to do, and patients will pick it up themselves, that when you feel a certain way, like a little groggy or headache, or you feel a tingling on your lip, or a little itchy, then starting the medication at that time, whether it's a tablet or a cream, it will decrease how long you will have that symptom or that obvious sore or whatever.
You mean they can cut at 7 days to 5 days?
Yes, and it can prevent it in some instances from coming up at all. But it also, there's some studies that demonstrate that treating it or being on medications for herpes for a long period of time can also decrease your chances of passing it on to somebody else.
Exactly. Suppression in a sense, yeah?
Say again?
Suppression in
yes,
a sense.
Yes. So, it's a little bit of a gray area, but in general, having it treated decreases the risk of passing it on to somebody else. So herpes is one of those that is not curable, but it is treatable. And it's very, very common. Very common.
Let's move to HIV, which most people are very focused on.
Right.
And in most countries, it is something that people focus on.
Right.
Tell me about HIV in Jamaica. And you wouldn't have to go hardcore statistics, but what's happening now with HIV?
Right. I talk about HIV almost every day. It is common. About nearly 2 out of every 100 persons in Jamaica has HIV.
That's a lot.
Yes, it's 1.something%. So nearly 2 out of every 100 persons. So it's a high burden here, and Jamaica or the Caribbean is second to only the places that we see on TV in Africa where we have a raging epidemic. So it's quite common. It is a sexually transmitted infection primarily. So you get it through sexual intercourse, but there are other ways: blood transfusion.
Needle stick injuries, possibly.
Those are the main ways, but sexual transmission for sure is one of those ways. There's no cure currently for HIV, but there's a lot of work and research and a lot of hope towards finding something that can perhaps eliminate this condition. However, it is treatable. It is treatable. There are anti-HIV medications that are very effective.
And very affordable now.
Yes. In fact, our patients in Jamaica do not pay directly for those medications. They're covered by the government or donors to make it accessible.
I mean, at DrugServe, I've written prescriptions where I see patients will have 2 of their antiretrovirals and they pay like $200, like heavily subsidized.
Right. So that $200,
and that's for 30 days, like $100 for 30 days.
That is just an access fee or an admin fee.
Right.
And I think there's also a psychological component to it because people may not value things that are absolutely free to them. So even if you charge them $1, they may value and appreciate it more.
Wow.
So there could also be there is a psychological component to it as well. But fortunately, these medications are accessible, and if taken as prescribed every day for the rest of your life, so it's a lifelong treatment, you live normally like anybody else. You can have children, you can have sex, you can have a life, you can have a family, you can live until you're old, until something else, natural causes call you home.
Let's
so
talk about I'm taking you into PEP and PrEP.
All
right, so PEP PEP is post-exposure prophylaxis. Like if me as a doctor get stuck by a needle that was used on a patient with HIV and I could potentially be at risk of contracting it, I then go on a course of medication. Tell me about this.
Yes.
Or if you had sex, could be sexual contact as well.
Right. So, and unfortunately, it's not widely known by the general population that this is an option that is available, that you are entitled to. In that we experience condom slippage, condom breakage. Many people can tell you that during sexual intercourse, the condom, they realize that they're doing all of that, and after climax or ejaculation, you're looking for the condom, and the condom is gone somewhere. It can break. Some people are very well endowed, and the condom doesn't fit properly.
Or use 2 condoms, which is not something people should do.
2 condoms should not be used because they rub against each other and they break. And some individuals use oils that can break the condoms.
Baby oil and all sort of other things that are not friendly to condoms.
I've heard about car grease and all those things. Gosh. You catch what you can to use, but it's very dangerous because it breaks the condom, it ruptures the condom, and people do experience this. And instead of staying in a corner at home hanging down your head in shame, nervous, not knowing what to do. Oh my gosh, I might have just exposed myself to HIV.
You had a 72-hour window where you could have gotten help.
Right. You have a 1 or 2 day window in which you can talk with a doctor, usually in an emergency room setting, to say, hey, I was having sex, the condom broke, I don't know the other person's HIV status, or the other person may be HIV positive. What does this mean for me?
Right.
If you're given anti-HIV medications within that 1 or 2 day window period,
because it's more effective in the first 2 days,
it significantly reduces the risk of your becoming HIV positive. But people don't know this.
Yeah.
People don't know this. Whereas in the medical fraternity, it's something that we do because we're exposed to blood. Something can splash in your eyes. You can get stuck by a needle or a piece, a device, equipment that has been used on a patient whose status.
But the beauty of it is that you may prevent yourself from getting HIV. But the risk benefit is that you may take this drug for 30 days and have some side effects. But that's 30 days versus a lifetime, right?
Yes, but it's quite effective. And I think if people knew about it more widely, then we would have been able to prevent quite a few infections, because the cost to society and to the individual for treating a person for life is much more. One of the instances that I'd like to point out in which especially I'd advise persons to go to an emergency room is sexual assault or rape or sexual violence. Even if you are in a home where there is abuse or you had an encounter that was not appropriate, you didn't agree to, you don't need to hide in shame. You really ought to go to an emergency room and explain what has happened to you, and there are certain things that an emergency room physician should do
to protect you and should do, right?
Yes. And it's very important because it can change your life.
I'm glad you made that point. I'm glad you made that point. And let's go over to the other one, which is PrEP. And what I do know about PrEP is that a lot of people associate it with the homosexual community. They assume it is, but I know it isn't. Define PrEP for me and tell me if it's available in Jamaica and how does it work?
Right. PrEP is a use of anti-HIV medications in someone who does not have HIV. So you don't have the virus, but you want to use the medication because if it's in the body already, should you come in contact or be exposed to HIV will not take hold on the body. It will not establish an infection.
It's like you have an onboard security guard.
Right. You won't get it. However, it's very important that you are tested, because what we use to prevent HIV infection, a negative person, is only, let's say, half of the medication that is used to treat HIV, and you don't want to give an inappropriate dose to somebody because that will prove problematic later on. So the good thing about PrEP or pre-exposure prophylaxis or using anti-HIV medications in negative persons, especially those at high risk, is that it would be provided as a part of a combined package. So it's not just PrEP, the anti-HIV medications, because it has no effect against other sexually transmitted infections. It doesn't protect you against gonorrhea, doesn't protect you against syphilis. So it's important to use a condom, which is effective against those things. Also, it doesn't prevent pregnancy. And so it's important to remind patients or individuals that they need to also use those other protective measures. It is not yet available per se in Jamaica, but there are efforts to bring that possibly on stream as a part of preventing infections among populations that are at extremely or relatively higher risk of
but it has been proven HIV. To protect everyone, right? So it can benefit anybody.
It has. I mean, I knew about PrEP before, but working in the US, I would go to a clinic for my checkup or whatever, and I ain't asked no question about no PrEP, but it is offered to me as standard of care.
As in your counseling, it comes up.
Right, as a minority.
Right.
Because the demographic in the U.S. that has the highest burden of HIV infections are Black and Latino individuals.
Right.
So based on my profile, my ethnicity,
it would be offered.
It was a flag automatically that this should be offered to me. So in Jamaica, our demographics are a little bit different in that individuals who are same-sex loving or same-sex experienced, primarily men, are at a relatively higher risk of being exposed to and contracting HIV and other STIs. And so that would probably be a priority group, as well as individuals who are sexual partners of individuals living with HIV, because you do have couples, married couples or girlfriend, boyfriend, or common law relationships in which one individual is living with HIV
and the other isn't.
And they're living healthy, but the other person isn't. And you can have instances of condom breakage, and you can have condom slippage, or the person just wants to have an additional layer of protection, even though we know scientifically now that if a person is taking their medications, living with HIV, and you're taking your medications properly every day on time, around the same time every day for life, and it suppresses or
they
stops.
Should be so suppressed that they should not be spreading.
It stops the HIV from multiplying in the body. So there's no HIV available for transmission or being passed on.
That's even added. So one compliant partner who is positive, and then the negative partner on PrEP should keep them pretty safe.
So, these are things that we're discussing in Jamaica, but it is not yet implemented or available as a prevention strategy. There are many factors that a country or a program has to take into consideration, including cost, including whether people are interested in it, whether people are concerned about the side effects, because you can introduce PrEP to somebody, but they may be concerned about any side effects from the medications. All
right. Well, I was going to ask you one quick question about the flagging in the US of the minorities. Is that tied to a cultural thing? Does that come back to culture again? Black and Latino minorities, behavior patterns?
It's many things. It is complex. It is human behavior. But
why not Caucasian?
From a public health standpoint, when they have the numbers in front of them and you look and you see where is the highest burden of HIV infections, it is those persons who are marginalized. And remember that marginalization is driven by negative social attitudes. So these minorities endure discrimination. You tend to have lower paying jobs. You are working 3 jobs just to survive.
So it's multi-layered. It's complex.
Definitely.
All right, let's just quickly touch on the curable ones. Gonorrhea.
Yes.
Usually in men, you get an nasty, yellow, milky, copious discharge. Not fun. But women could be asymptomatic.
Men can be asymptomatic too.
too.
And in fact, I would say most people with an STI have no symptoms.
Yeah, generally.
So I think it's important not to just wait on symptoms, but we may have to have a broader conversation with patients or individuals to see their exposure, possible exposure. Are you having unprotected sexual intercourse with many partners? That is a risk factor. I would definitely screen a little bit more closely for those individuals. So your testing
pattern should be linked to your risk.
Yes,
your behavior risk.
For sure. But gonorrhea is definitely one of those that can be without symptoms, and you can pass it on even if you don't have any symptoms. And what persons may have happen is that there are complications later on in life, like it affects your fertility. So because the inflammation from that blocks the tubes
if left untreated,
and it causes a lot of problems later on, but it is readily treatable now, even though there are multi-drug resistant strains emerging.
About resistance,
but in general it is treatable with a simple injection or tablets. And if somebody thinks that they may be at risk, talk with your healthcare provider. You can have a test even if you don't have any symptoms.
All right, I'm not going to do all the diseases because this is not a medical class. But I know Yohann can definitely tell us about them. But other things that are treatable and curable include syphilis, gonorrhea,
for sure.
What else? Anything pops up to mind? There are a lot of them. So you can go deep. So we won't go too deep.
Chlamydia, right? There's quite a few, and there's some long names: lymphogranuloma, venereum. Lots of exotic diseases. It's a whole ecosystem. But they're treatable, and a part of treatment is being able to have a conversation with your provider about the possibilities of having been exposed through your sexual encounters or sexual behaviors, and being able to access testing. And sometimes we treat. If we believe that you may have symptoms related to one of them, we will tend to treat for all, because they do travel in groups.
They hang out in a little crew.
Yes, that's a good way to put it. They hang out in a little crew because it's the same mechanism that by which they're spread.
Well, let's talk a little bit about maybe to the average person what may be the weird and uncommon. And this is going to come back to what you just said about being able to have open conversations with your doctor. Even me as a doctor, I encountered a case where someone had rectal gonorrhea and they had no symptoms. And in that situation, they infected someone else. So this would apply to anyone having unprotected anal sex, right? So we won't just make it sound like it's a homosexual thing. Could be anybody.
Right.
The truth is that the typical test for gonorrhea is a urine test, a PCR test, which is sent to the lab. But who is doing a rectal swab these days? Are people do people even know that they should probably do this in an at-risk person?
Yeah, and the testing the urine is one way of testing, but there are several other ways of looking, and
you can touch the pharynx too, because that's another thing, pharyngeal gonorrhea.
Yeah, but it as we've said earlier, it's possible to have these infections and not have any symptoms, and not having symptoms during that period, you can still pass it on to another individual. So that brings up a point for me that if you, as physicians, if we encounter somebody with a sexually transmitted infection, in addition to treating for all the other ones that could be a part of the crew or the gang, it is important to treat the partner.
Yes.
Because the person coming to you will be cured, but then they're going back to have sexual intercourse with the person from whom they contracted it. And then they keep on passing it back and forth.
Reinfection, right?
Right. So it's really important to counsel the individual in front of you to encourage the other person to go and access treatment. They can come to you or they could go to their regular physician, but it's important, even if they have no symptoms,
right,
to seek treatment.
I actually really admire couples who come in together to have the discussions. It's a little nerve-wracking for me sometimes. Sometimes I separate them before I bring them together, because usually sometimes there's a sub-story. So the man having woman, but him have a side woman, and that's the reason why this is going on. So he's bringing it in from outside, and that's not going to happen with the two of them sitting down in the same space. So that can be a little dicey. But for me as a doctor, I separate them, then I bring them together. And I remain confidential, and then I see what happens when they're together, and we just do what we need to do and treat. But
it can make very interesting encounters, indeed.
Because we don't want no fight in my office. All right, a random one for you, Yohann. Do you think someone can catch an STI from a sex toy? And let me be specific. Let's talk about a woman using a dildo. All right, maybe two women and a dildo. So maybe one woman has a discharge. She's used the dildo, and then now the other woman is about to use the dildo.
Right.
So we're talking quick movement from one vagina to the next.
Yes, it is possible to pass on any sort of infection in that way. Toy hygiene is highly encouraged.
Hygiene. Is this a thing? Should I Google this?
Well, I don't know what else to say.
I like
it's hygiene. It's a toy.
It's
so
brilliant.
Keeping your toys
clean. Yeah.
Soap and water, appropriate disinfectants, etc. But if you're going to share toys, of course, even fingers, you don't need toys, because if you use your fingers to finger
whatever
an orifice and then introduce it into another orifice, you are,
technically moving things from one space to the next.
Indeed. And remember, there may not be a discharge. You could be asymptomatic and still be spreading things.
After this episode of Talk Truth, no one is having sex again, right? But what about the like that, like a principle with food, like the 5-second rule? Right, this doesn't bad analogy. Most bacteria, viruses will die outside of a mucous membrane. So I said quick transmission. Flip side, toy goes in, toy comes out. Toy is out for 15 minutes. You think everything would have dead upon the toy?
50, these pathogens nowadays with climate change and all. That's an exaggeration. But 15 minutes is not really long. And I because you could leave something there. There's probably some membrane on it that's protecting
the virus, or it's moist or something that allows it to stay.
Exactly. So, and even basic hygiene. I mean,
Because people catch cold and flu from doorknob, right? Fomites.
And other things from doorknobs too.
Oh
so
gosh,
yes,
you I know.
People are adventurous. You know?
Oh wow! All right, I really love the direction this has been going. As we come close to wrapping up, I want us to talk about something more social. I mean, in terms of, you may have given me an STI as a conversation that I want to briefly touch.
Mm-hmm.
And with the advent of Tinder, apps, Instagram, Grindr, however people meet each other on the networks and hook up.
Mm-hmm.
You may have a sexual encounter with a stranger or a regular partner.
Mm-hmm.
There's so many layers to it though. How do you broach the conversation with a stranger, you know?
Yeah.
Do you even talk to them, or you just go for your prep, your pep?
I think you just say it. You just do it. Like Nike says, just do it.
What
just
if I
bring
didn't
up
have
the
their
conversation.
number? I have to DM them. They could have blocked me. I don't know.
Well, first of all, it's really important to encourage individuals to take responsibility for their sexual health and well-being.
Yeah.
So have a communication with your healthcare provider. Healthcare providers, I think nowadays, are very accessible. You can check in with them, do your regular checkup once or twice a year. Keep yourself informed about various STIs and symptoms and what you can do to protect yourself. So individual responsibility is very important.
I love that.
And the more empowered you are and the more informed you are, then the better you are able to have a conversation and to also empower somebody else. Because if you're getting some good sex and you like it, you're probably going to want to go back to that person. So you want to make sure that they're healthy too.
Exactly.
So raise the conversation, and sometimes we're tempted to do things that we know is not really ideal. And so you have to bring up that conversation that says, I got tested last week. How are things for you when last you got tested?
Right, you have to find a way to
Yes.
introduce
You
it
just
without
have to
even
say
being
it.
offensive.
Close your eyes and
Yeah,
put down your face in the
just
pillow
hope
and
it
say
will
it.
work, yeah.
Yes.
But what you said, I love, and that is, you may not be able to control what the other person is doing, how they may respond, but you have your
Exactly.
own personal responsibility.
Mhm.
All right. And in terms of frequency of testing, how often should people test? And I know this might be tied to the window period if
Right.
it's HIV.
Right. It depends, but if you can get a test at least twice a year,
Every
but I would
6 months,
say if you're having more sex and you're in some groups that are higher risk, then every 4 months, 3 or 4 times for the year, it's nice to do that. Why frequent testing is also important is that you can have what we call a window period,
Yes.
in which, because some of the tests are not testing for the germ itself, they're testing for how your body is producing antibodies to it,
Right.
which takes time.
Right.
It can take up to 3 or more months for your body to produce those antibodies. So if you're testing for antibodies, you can miss it if you got the infection today or yesterday. However, we have newer tests that can also test for the germ directly.
Which will be more accurate
Right.
and
So
faster.
in some instances, we can pick up an HIV positive case, for example, within like 2 weeks of exposure,
Right.
depending on the test that you're using. We call them 4th generation tests, etc. But still being mindful that tests can also be faulty.
Yeah.
You can make a mistake.
False negatives, false positives.
So it's about, and it's a very important thing that you're asking, Mario, because somebody can also do a test and it's negative this year and they never test again.
Right.
I was negative in 2009. I'm good for life,
Right.
and they feel that no, it gives you license
And that
to do
could have
anything.
been a false negative.
Could have been a
so
false
you're
negative.
actually positive.
Right, but as long as you're having sex, you are at risk, and it's really important to be in the habit of keeping yourself healthy, getting yourself checked out, and if there are any STIs that are curable, treatable, have those treated, because having another STI increases the risk of getting HIV and so on. So it's about being proactive and being a habitual tester and not just doing a one-off thing. And the other thing that some persons do is that they're in a relationship, whether heterosexual or non-heterosexual couples, the other person tested and they're fine. You don't test, you assume that you're fine because the other person is fine. But the thing with the HIV virus, for example, is that not every encounter or exposure results in it being passed on.
Right.
Sometimes it just doesn't get passed on. Otherwise, we would
so you just
have
got,
a
you got
worse
lucky,
situation.
right? Yeah, you don't always have to contract it based on the mechanics. Yeah.
Just because your partner's test is negative doesn't mean that you're negative. So everybody really ought to go in and get their own testing and counseling and keep themselves informed.
My last question on the window period. When I was in med school, I remember it being a hard 6 months. I know that people say 3 to 6 months. And from what I gather from that, is that your test may become positive in 3 months. By 6 months, if it's not positive, you should be negative. How do you feel about the 3 month mark? Should it really be a hard 6 months?
In a way, it kind of doesn't matter, because if you get tested every other month, that's also good too. Their testing is widely available now.
Assuming that you're not having any other intercourse from that one, right?
It.
So that's it. So let's say we had one unprotected encounter, and I haven't had any more sex. I'm waiting to test again because I'm paranoid and I'm dying.
Right.
The 3 month mark, is it
3 months
necessary?
is a good little measure. Within
It's a
3 months,
measure.
most people would have mounted antibodies that would be picked up by the test. And most testing facilities now have the 4th generation that tests directly for the germ.
So you would definitely be there at 3.
So by 3 months, you will be definitely, more than likely, be able to pick up the germ.
Wow. What can we do moving forward, you think? What are some of the steps that we should take? And I'm sure this is what you do every day, some of the programs you develop.
I think it's really important to not assume that people subscribe or fit necessarily into these cultural statements and boxes that we say men do this, women do this. Just assume that everybody is doing everything with everybody.
And doing everything, because I remember when I was dating a girl, and I remember one of her friends or siblings were pretty much telling me about habits of teens in her age group. And I was shocked because she was telling me that they're doing this and that. I'm like, are you? Yeah. And this is in a context of boy and girl. And I was like, really? Yeah. Boys aren't doing that? Yes. So everybody is doing everything.
Everybody's doing everything.
And I think pornography doesn't help that either, because I think the porn industry is like almost like a little tutor. So people see things in pornography and wish to go and take it home and try.
But I've heard people say nowadays that porn is boring.
So they are trying new things. They're tackling, they're challenging the porn.
People are getting adventurous. So people are doing everything, and it's important to not wait, as a physician, to leave the conversation very open. Don't ask somebody about their girlfriend or their boyfriend, because you can't ask them about their partner.
We have to be sensitive to that, because that's the reality of it.
Definitely, because you want to contribute to somebody keeping themselves healthy and being able to come back to you if they have a question.
And at the end of the day, keeping people healthy and safe is our aim, right?
Definitely.
Yohann, this has been such an amazing pleasure. Trust me, I feel like I'll definitely have you back, and I want you to please plug your practice, because I want people to know where they can find you if they want to seek help from you in this space or any other GP space.
Indeed. I am located at number 1 Phoenix Avenue. So there are other facilities on that street, but always remember, we're number 1. I say to people, we're number 1. So come to number 1.
Come to number 1.
But I'm always happy to receive individuals who are desirous of obtaining care.
When are you opening hours?
We're there every day. You can call us 754-1381, and we're very flexible. So if we know people have to go to work and they call our staff and tell us they're going to come in at 7 tomorrow, we'll be there to do something with you before
just
you
by
make
appointment mainly. Only right now.
Not only, but
mainly.
We accommodate those persons who are extremely busy. We do a lot of work with companies, and so we understand their schedules, and sometimes we even go to corporate companies to set up there and help their staff who are too busy to make it to the office.
And the company name is Para Caribe.
Yes, Para Caribe Consulting or Para Caribe Medical Doctors. We're on Phoenix Avenue, Kingston.
Social media
at Caribe Wellness. And so we're on Twitter? Facebook, Twitter, Instagram. And that's our name across all the platforms, at Caribe Wellness.
Yohann, again, it was a pleasure. Thank you so much for talking the truth.
Oh, thank you.
All right, take
Happy
care.
to be here.
Guys, thank you so much for listening to episode number 5. And I hope you really learned a lot from this episode. And sexual health is very important. So us here at Team Talk Truth encourage you to go out and get tested. Don't be afraid. There are tons of resources out there, from even a Caribe Wellness to a Dr. Mario Guthrie, to your own health center in your community, the hospitals. tons of resources exist for you to know what's happening with your health. So definitely go and find someone if you have any questions about your sexual health. Also, of course, if you liked our episode, please follow us on Twitter at TalkTruthJA and follow me on Instagram at Mario Evon. And please retweet, share, post, follow, do everything that you can do to make this podcast be heard by more people. When you're sharing, use the hashtags TalkTruthJA or MeTalkTruth, not or, and MeTalkTruth. And we appreciate iTunes reviews. So go into iTunes and not only give us a text comment rating, but a star rating. And we'd be glad to read your comments on one of our future episodes. Boy, this is always such an amazing pleasure. Remember to go into the show notes for more details. You can find more information on Caribe Wellness, and you can also find the bullet points for the entire show, links to the website for Talk Truth. Everything you need is right in the show notes. So go to the website, talktruthja.com, and you'll find everything that you need. I am Mario Evon, and you are listening to Talk Truth, a place where your truth shall become your power and set you free. Until next Sunday, guys, stay safe. Blessed love.